Welcome to the Resolution Room. I'm joined with two guests today, Dr Tim MacDonald, welcome.
Thank you.
And Vanessa Daniel from mlcoa.
Thank you.
Listen, I want to announce first of all a collaboration between the Resolution Room and mlcoa. So this is a collaboration called Law, Medicine and Everything in Between. And what we're going to talk about today with Dr Tim, a psychiatrist, is ADHD. It very much hit the zeitgeist. I mean, ABC stole our thunder last night on Four Corners with an expose on ADHD. But of course, what could Dr Norman Swan and the broadcaster tell us that you won't, and the Resolution Room won't be able to tell us?
Quite a lot.
Quite so.
If it's the right Norman Swan.
Potentially, that's right. So that's really what we're going to talk about today with you, Dr Tim, and Vanessa as well. And then we're going to talk about what people really want to know as well, which is practical insights. How is this managed at a workplace level? Some of the takeaways that we can leave people. And for that episode, we're joined by Andrew Rich, who's a partner at Gadens, is a workplace lawyer. And I'll introduce Andrew in due course as well. So this is a great collaboration. I've worked with mlcoa for many years, and mlcoa is the largest provider of medicolegal services in Australia. It's got over 400 specialists, and it bridges the gap between clinical expertise and, of course, what lawyers need at the coalface in terms of evidence and practical solutions. So by way of introduction, let me see if I get this right. You're both ridiculously overqualified, okay? But let me see if I get this right. Dr Tim, you're a psychiatrist, you're a fellow of the Australian College, you've got 3 subspecialties: adult psychiatry, addiction and consultation and liaison.
That's right.
And you've been most recently a former Director of Medical Services at Currumbin Clinic.
That's right. That's
and
correct.
Now you're at Griffith University and you're a medico-legal expert as well in psychiatry.
Yeah, I'm a senior lecturer with Griffith and just do a very small scale medico-legal practice, mostly with mlcoa. Just joined them.
Excellent. And Vanessa, tell me about yourself.
I'm the National Customer and Legal Manager for mlcoa. So we work mainly with legal referrals that are complex, guiding people from inception to end, providing insight and empathy and everything else along the way.
All right. So this is called Law, Medicine and Everything in Between. And when we discussed ADHD as a topic, little did we know, of course, that it was going to be reported on last night. And as we're recording this on the 21st of April, so this won't come out for a while, but it's really interesting that obviously there's part of a broader concern around the rise in adult diagnosis and, of course, what this means. So today's episode, we're going to drill down from a clinical perspective. What is ADHD? How's it diagnosed? And how's it treated? Before we talk about some of the workplace strategies. So let's first start with you, Dr. Tim. You're an adult psychiatrist and you've run a medical director at Currumbin, which is a private clinic. What are you seeing at the coalface in terms of ADHD?
I think over the last 10 or 15 years that the frequency of self-presentation and referral rates of ADHD have increased dramatically. We see it as a combination of increased mental health literacy in the community and knowledge amongst referrers, the rise of perhaps social media and people self-educating about attentional disorders. 10 or 15 years ago when I used to do talks about psychiatry, it included things like ADHD, I had to try to convince people that ADHD existed. And now it's more about almost doing the opposite at times.
Yeah.
That perhaps it's overrepresented in the referral and self-diagnostic sense.
And that was, I think, something that was explored more broadly by Four Corners last night, particularly the rise of the adult diagnosis. Is that a feature of the fact that it was missed in childhood, or perhaps a feature of the better literacy, as you called it?
I wouldn't consider myself an expert in ADHD, just to mention that first of all, but I don't believe in the term adult ADHD. It's either you've got ADHD or you don't. As a child, some people will develop, it's a neurodevelopmental condition. As you become an adult, some of those symptoms may become less prominent. Some may become more prominent under less structured situations. I don't think that someone just develops ADHD as an adult. They can certainly be diagnosed as an
But it's
adult.
always existed at some level,
But
is what you're saying.
it would have always existed
Yeah.
somehow, or been contained or subdued somehow through circumstance or treatment.
I see. And what are some of the common symptoms? What do people present with commonly?
When you say ADHD, you have to also say other diagnoses, because it's part of a plethora of conditions that are often superimposed on each other. But ADHD itself it's a polythetic construct, so it has a range of inattentive symptoms, a range of impulsive and hyperactive symptoms, and then there is a subtype of it which is mixed, which is the most common.
Right.
And the genders will present differently.
Mm-hmm.
So if you're a boy, you're going to present with more hyperactive, impulsive symptoms, and probably be more likely to carry on some of those symptoms more obviously into adulthood. The mixed or the inattentive subtype can sometimes fly under the radar, and especially if you're female, because the boys, if they're hyperactive and bouncing off the walls and throwing things, they're obviously impaired in some way, or they're easily diagnosed, but the others not so much.
And so if you've got someone coming across you in a clinical level, is there a diagnostic tool? Are you working through the symptom pattern? I mean, how do you diagnose it?
Such a good question, because it's a symptom cluster. ADHD. I mean, we have a rough idea anatomically and physiologically what might be behind it, but not really what causes it. And so if you're looking at a normal distribution, a lot of ADHD diagnoses are people who have certain traits at the end of those spectrum
Right.
of normal. If you have enough of those symptoms and it's impairing enough and you notice it enough, then it can become a diagnosis. It is a clinical diagnosis. There's no test
No.
that you can do for ADHD. You can't scan a brain. You can't do a specific questionnaire. You can't do a computer test.
No.
You can't do a neurological test.
It's
And
very
then-
much about the judgment of the clinician based on the symptom pattern and what people are reporting.
That's right. And that's why you need to know what roughly normal might be for a specific age group.
Yeah.
So ADHD is more likely to be diagnosed in children who are younger in their year levels at school, because they're not as old
Right.
as the other kids. Whereas the older children in the same year level are less likely to be diagnosed with ADHD.
That might be a good time to bring in you, Vanessa, because what Dr. Tim was referring to is obviously the subjective nature, but the important clinical nature of a diagnosis for a psychiatric condition that is very prevalent. Can you comment more broadly on that in the medico-legal context and psychiatric injuries?
We are seeing a rise in these requests for ADHD assessments as well too. And it's interesting, after watching Four Corners, how they were sort of saying that questionnaires and all those things don't provide diagnosis, and they need a special assessment, not necessarily an ADHD assessment. Is that what you think, Tim? What do you
That's
think?
what I think, because
Yeah.
with all due respect to the ADHD assessors, sometimes when all you've got to hammer, everything looks like a nail. And a generalist approach
Yeah.
to diagnosis is usually a better way to start.
Yeah, they were touching on that. I haven't had an opportunity to look at that, Vanessa, but one of the things they were talking about is this clusters and where they're formed. WA incident, isn't that fascinating? Fremantle is a really interesting cluster. I don't know why, but obviously sometimes it coincides with the level of affluence in terms of parents and others identifying and having access to it. But one of the things they were referring to on that point was the increased use of telehealth assessments, which is potentially problematic in terms of the reliability of the diagnosis, if I can refer to it as that.
I believe that's probably a reliability factor. The in-person assessments are generally more thorough. Someone with ADHD might forget to turn up
Yeah.
to the appointment, so telehealth might be better for them though.
Yeah.
But I think from my experience, people with ADHD are far more likely to forget to attend a telehealth appointment because it's not at the forefront
Yeah,
of their
yeah.
planning for the day and where they need to physically be.
And of course, with the democratization of medical information in terms of the, tech and AI, people might self-identify at the beginning with various symptoms, hyperfocus or lack of focus or distraction, or so people probably come to it with a thinking along the lines of, well, hey, this sort of fits. Do you see some of that as well?
Definitely. The self-diagnoses like that, a lot of them have a lot of challenges in their life. And they've undergone a lot of transitions more recently, like to a different job, or they've had another child, or there's been another stimuli that's entered their life that's thrown them off a bit, and that could explain why perhaps that threshold might then become obvious.
So if you were to say the symptom, it's got to be presented as a pattern of symptoms based on clinical judgment, based on really interrogating the presentation effectively and understanding it, what would you say would be some of the more common symptoms and how that plays out in people's functioning?
The common symptoms of, say, some of the hyperactive,
Yeah,
impulsive symptoms are the ones that are, obvious and probably more interesting.
yeah,
And people might complete other people's sentences before they've finished. They'll be impatient in traffic, have trouble waiting in lines. They won't be able to sit still during class or read a book, watch a movie. They might not be able to complete a conversation with someone before they're distracted by another topic that's more, or another thing that's more interesting. You're more likely to hear the story, oh, they were always off with the butterflies, weren't paying attention during class, the cute kid that wasn't really doing much because they weren't listening,
yeah,
but
yeah.
weren't causing any trouble.
And is there a correlation between the diagnosis and, say, self-medication and addiction?
Yes. So with ADHD, there's probably an issue with dopamine in the brain.
Yeah,
And if we talk about the dopaminergic hypotonic parts of the brain that are affected there, you need more stimuli to get those parts of the brain working the way we want to have them working. And so something that's interesting, or something that has salience, or something that stimulates like a drug, or something outside the classroom that's more interesting than what the teacher's saying, is going to take salience over
yeah.
something else.
Which is why when people, and you've probably come across it in your friendship circles as well, Vanessa, I certainly have, they've identified, I've been diagnosed with ADHD, and often you'll find they have a superpower in the sense that it's also gives you amazing focus in what you're really into, so to speak. And so there's often, as well as it being a sort of a negative identification, it can be quite positive in certain aspects. It's about that balance. Have you seen that?
Yeah, I have definitely a bit of perfectionism and stuff traits, something that they're fascinated with,
That's right.
a hobby or just something they're really interested in and pursuing that, and also a bit of partying sometimes as
Yeah,
well.
that's right. That's right.
I've seen those.
We've seen that.
I guess that's how they cope and
Yeah,
stuff
yeah.
as well. And
It's a good excuse to exercise your superpower.
That's
definitely,
right.
probably.
Well, so you've spoken about dopamine and how it plays out, which is so in a sense, there's an overstimulation, but yet it's treated commonly by a stimulant. Is that the common treatment pathway?
So the brain is less active in ADHD. And so things that stimulate the brain will bring the brain levels of activity up to where normal might otherwise be. And so if you give understimulated brain stimulants, that then will normalise a lot of the function of the brain. If you look at someone with ADHD, you could almost say that they appear overstimulated, but it's not. They're actually trying to seek stimuli from the environment to increase the level of stimulation of the brain.
And am I right in saying that stimulant is the common clinical pathway to treat ADHD?
It is. Excluding comorbidities and assessing and managing comorbidities as well is really important, because there may be some there that you want to treat first before you treat ADHD. ADHD treatment is not always synonymous with stimulants though either. Some people think it is.
Mm.
There are plenty of really good non-stimulant treatments for ADHD. They may take a little longer to work, but for some people they can be far more effective than stimulants because they may not have the side effects of stimulants that you want to avoid in some people.
On the four corners, yeah, effectively they were saying there's an overdiagnosis potentially and maybe a seeking out of stimulants. The other things that was explored was, and it's not very scientifically solid yet, but some concern around one of the side effects being potential even psychosis. And have you seen that play out, Tim? Have you seen?
Plenty of times,
Yeah.
more in public psychiatry than private psychiatry. If you look at the types of dopamines in the brain, you can kind of narrow it down to two types. There's the tonic phase of dopamine, which is the baseline, and then there's more phasic dopamine changes, and they both serve roles. The tonic dopamine phase that can be increased and decreased slightly without any problems. That will change someone's attention or salience or concentration levels. If you give someone enough, or if they take stimulants on top of it, or cannabinoids and other psychotomimetic substances on top, then you might actually reach a level of stimulation that would cause a phasic dopamine change.
Right.
And if that phasic dopamine change is severe enough in someone who's predisposed or not predisposed, then you can see psychotic symptoms emerge.
That's at the really bad end of the spectrum, if I can say that. What are the other common side effects from stimulant as a form of treatment?
The common side effects are really quite mild and tolerable. So for people who have ADHD, they might find that their mouth might be a little bit dry, or they might not have as much appetite during the day. The first few days they might not sleep quite as well. Sometimes, rarely, a headache, a stomach ache. They tend to reduce over time. So the people, if they maintain their treatment for ADHD, those side effects tend to diminish. They tend to become tolerant.
Do you think it's too cynical to say that there is a sense of seeking stimulants in terms of this diagnosis?
I think we need to bear it in mind all the time. I think we'd be silly not to. But I think if we only saw it that way, we'd be just as blinded to the group of children and adults out there that have potentially one of the most treatable conditions known to humankind. If someone has ADHD and if you get the diagnosis right, you can almost always treat it quite well, usually with medications, but there are other non-medication treatments as well that can manage a lot of the symptoms.
Let's talk about that, Dr. Tim, non-pharmaceutical treatment.
I'd like to talk about exercise
Yep.
and greenery.
Yep.
Not cannabis.
Yeah.
Greenery generally as a treatment. People with ADHD have been camping, hiking, playing sport, going for a run in the morning. They tend to be a lot more settled for the day or for the days afterwards. There can be a lot of planning that goes into managing their symptoms in terms of compensatory mechanisms with taking notes, having checklists, having alarms, having enough sleep, having a diet that's well balanced. There's really good evidence for fish oil, probably level 1 evidence, but it's only small.
Mm-hmm.
There are some other non-medication options as well that have very, very tiny amounts of evidence that are probably not worth mentioning. And psychotherapy for coexisting conditions. If you've got someone with ADHD who's a perfectionist who fails exams despite their ability being well enough to pass the exams, and they might need to dial down that measure of what success or perfection actually is.
Yeah.
Or they may need to reassess how they judge themselves as a person or look at their core beliefs. So those other things that might do with a psychologist as well, or an ADHD coach
Is there rises in ADHD diagnosis in the increase of social media? Is that what we're seeing? Like just listening to you talking about the greenery, being outside is the flip side of that, that we're seeing more of these cases. Where we're getting the requests too for children to have ADHD assessments. Is it the rise in the social media, or is it, like the stresses? Like life is complicated at the moment, and look at all the external factors.
So not just the
Yeah,
influence of the social media, but the being online
just
and
being online with
having
children.
an
Yeah,
artificial light stimulus as well, changing the way that you're going to function outside of that environment. People that are doing gaming and gambling online can be part of an impulse dysregulation.
and then it disrupts the your sleeping patterns and rhythms, and that all exasperates underlying conditions and stuff as well.
And it's always interesting when you see someone that you've treated
Mhm.
actually
On TikTok.
on TikTok or on social media speaking about their treatment or their psychiatrist.
I can hear that. I mean, now that we've got this increased awareness of, say, tech and the addictive nature and some of the policy responses, which I think are welcomed, about navigating the addictive forces, there's been class actions, of course, in the US, and Australia's led the charge in many ways. So what we're talking about is, in a sense, putting aside ADHD and the symptom pattern, we're talking about a more distractible, dopamine addicted sort of environment anyway, aren't we? And particularly for our children, which has to play some part, I would have thought.
Draws an absolute contrast. If they weren't in that environment, potentially it wouldn't be noticed.
It's an old Netflix doco now, but under The Social Dilemma. I don't know if you saw that. It's years ago. It was really fascinating to me that these tech moguls said they wouldn't let their kids anywhere near social media, which I thought was fascinating. Was fascinating in itself, and I thought, oh boy, that's quite telling. But so what we're talking about is a symptom pattern, and also potentially a broader landscape, which mightn't help and may play some role. It's a good question.
And how it plays out long term, then we're seeing the assessments at the, when they're needing intervention. But is there other ways that we can intervene early, help our children? Like you mentioned, being outside, learn from this experience as well too. And even some of the stuff that they touched on in Four Corners, like people might not always realize that when they have ADHD diagnosis, that some part of the diagnosis they were saying they'll go back and look at your childhood, want to get statements. Yeah, it's a bit deeper. I'll let you
That's good.
explain more of it. Yeah, because we won't know at this level what was happening back then, but they'll need some type of guidance.
Yeah, that developmental guidance is crucial, but even still, you might not get the history that aligns with ADHD entirely from that, because they might have lost some of their school reports, or their parents can't remember, or their parents don't believe that ADHD was a problem and might give a disingenuous history. So you've got a lot of reasons why you might not get that perfect developmental history for it. It doesn't necessarily exclude the diagnosis; it supports it, and it backs you up in a potentially medico-legal sense.
Yeah.
Definitely keep your school reports.
Keep your school reports. It's about
It's not always a problem though. ADHD, like you said, it can be a superpower. And if you're like me and you subscribe to some forms of evolutionary psychiatry, it can serve a purpose. And every single symptom in it can serve a purpose.
Yeah.
Just like they can in other psychiatric disorders.
Yeah, it's interesting you should say that. I mean, when I'm old, of course. So in the 70s and 80s, we talked about the cordial kids, and people were saying our kids are really hyperactive. They were saying things like parents were saying hyperactive, but no one knew ADHD. No one would talk about it. But there was a sense that certain kids didn't fit the norm of school, and or they were really smart at certain things but weren't in that compliance bucket that school tends to reward. So what I saw that as a kid. Now I've followed obviously the rise in ADHD and obviously its prevalence. Well, that was a great conversation, and I really appreciate this opportunity to collaborate with mlcoa. I think we can cover off some really interesting conversations, bridging that gap between medicine and the practical reality at the workplace. So stay with us, because we're going to be joined now for the next episode by Andrew Rich, who's a partner at Gadens. And Tim, you've also been a leader clinically of a medical services at Currumbin Clinic. So we really hope to drill down on some of the practical strategies of managing this in terms of the functional way it turns up in workplaces. What is the legal obligation? What is the regulatory landscape? And try to bring it together, but hopefully leave people with some practical insights and takeaways. So thank you very much. Anything else you need to say, Tim, before we sign off?
No, I think that's the extent of my attention. Thank you.
Vanessa?
No, thank you. Thanks
Listen,
for
I
having
really
us.
appreciate your expertise. Thank you for joining us today and
No worries,
talking
Damien.
about such an interesting topic. And I think this will have broader resonance. I think clearly there is an increasing awareness of this in the community when you have people like Dr. Norman Swan in Four Corners, and we're looking at the clusters of diagnosis, the clusters of medication. I think it's obviously very relevant. And one of the things we're going to cover off with Andrew, an employment law partner, is how that all marries up with, of course, the right to privacy as well, which is also something that we need to think about in the workplace setting. So thank you very much for your time and expertise, and we'll talk to you soon.
No worries. Thank you.
Thank you.